years to come.
Colchester.
Mr. Speaker, a recent study stated that lockdowns contributed to saving 0.2% of deaths worldwide. Do you know what contributed to lockdowns in Canada, Mr. Speaker? The abysmal lack of healthcare capacity in that system. The $700 billion spent on COVID created no new beds and none of the promised 7,500 doctors and nurses from this Prime Minister have materialized.
Hear, hear.
Mr. Speaker, when will the government properly fund health care?
Hear, hear.
The Honourable Government House Leader.
Mr. Speaker, the opposition keeps referring to lockdowns, and I want to be really precise and understand exactly what they're talking about. What federal mandates do they oppose? Do they oppose that people have to be double vaccinated to get into a plane or to get into an airplane or to drive a truck? If they oppose that, as they have some of their members of their caucus who still are not vaccinated, can they say that? And can we have an honest discussion about the fact that perhaps they don't believe in some of the public health measures that have Canada have one of the lowest death rates in the world and one of the best pandemic responses in the world, Mr. Speaker?
The Honourable Member for Cumberland Colchester.
Mr. Speaker, in spite of the spin doctors, I am a doctor, and I want you to know that Canada has 1/3 of the ICU capacity of Germany and roughly half of that of the United States. The moral distress of working in an unsupported system in an overwhelming tsunami of backlog of cases looms. As Premier Horgan said on Friday, a quality service like this is not sustainable in its current model. When will this Liberal government end this moral distress and admit the pandemic crisis is multiplied by healthcare underfunding?
The Honourable Government House Leader.
Mr. Speaker, our ICUs are filled. Canada is continuing to be in a circumstances we're seeing globally where we have enormous stress. But I would say to the opposite member, who is a doctor, that does he not want to see those numbers come down? Would he not agree that the best way to make sure those numbers come down is that people are vaccinated, that the vast preponderance of people filling our hospitals are unvaccinated, that him attacking mandates that, by the way, on our side are about ensuring people are vaccinated are injurious to this and are filling our hospitals and are exactly the problem we're facing right now.
The Honourable Member for Lethbridge.
The Honourable Member